My name is Dr. Vikram Venkateswaran. I'm a part of the healthcare working group at the IET Future Tech Panel, and I'm also the co-chair of the healthcare working group. So disease surveillance is probably the most important aspect that is evolving in the global healthcare industry. We look at data today that is proliferated across mediums, especially digital mediums, and there's a huge opportunity to use that data to not only prevent diseases, but also to predict the next outbreak. Such data has been used sporadically, like in combating Ebola, like in combating HIV in certain cases. But the pandemic has put a new twist on this entire scenario. Today, we have the opportunity of not only collecting data at source, but also have high level of compute that is available across technologies like cloud that can be leveraged to predict the next epidemic. Though we caught up late during the COVID pandemic, the lessons learned globally have been that we can accelerate this development and use it very effectively to identify and combat the next pandemic. So the disease surveillance program that we are running as a pilot as part of our IET Healthcare Working Group was inspired by similar attempts made by researchers globally to understand spread of diseases. A simple case of using infectious diseases, especially during the monsoon season in India, was a good opportunity to not only see how far have we progressed in our adoption of technology, but see if this could be used in a real world scenario, like predicting the next epidemic or the next disease spread. The idea was to capture information at source, triage it, pinpoint exact locations, and see if we could triangulate as to where these mentions and data sources were coming, and could the local authorities be alerted to the very spread of the infection. We are calling this pilot as SARTHI, which is Social Analytics for Rapid Transformation of Health in India. What we have done is we have looked at publicly available data sources. This include consumer forums, blogs, news websites, as well as social media data sources like Twitter and Facebook. Wherever an API was available, we have plugged it into this system. Then we have written queries to suppress all the false positives or junk information to get to the real key information that provides insights. This is then through the medium of cloud using cloud databases has been rendered on a front-end application called Flutter, which is then visible to the user as dashboards, which not only show you locations of where the diseases are spreading, but also give you the numbers of where exactly and how the trend has been over the last 6 months. So some of the opportunities or challenges, as you may say, that we came across the road was did we have informed consent from patients? Now, consent is a big part of privacy, and as you can see, the new draft data privacy bill also talks a lot about consent. As IET works under GDPR, it was very important to have informed consent from patients to use their data. We overcame that by using publicly available data sources rather than using data sources where patient consent was required. The second challenge we came across was the volume of data. Though the volume of data was high, a lot of it was not relevant data. It was misleading data, false positive, or noise as we call in the system. And we overcame that by writing specific extraction queries where we identified the false positives and we wrote queries to reduce them. The last aspect was on languages. India doesn't use just one language. We use a variety of languages. So we went with the 10 most spoken languages in India. What we have done now as part of this pilot is we have taken a few use cases and correlated with local vector-borne information data released by the various state governments. We've done it in 3 cases. We've done it in Delhi, we've done it in Uttar Pradesh, and we've done it in Karnataka. But what we are going to do next is use our association with organizations like CHRI, who are also participating in this project, to do analysis, correlate the data that we have on the digital platform to what they're seeing in the local primary health centers. And that way we want to look at a correlation and see what is the percentage of that correlation. That on-ground validation is the most important next step. The step above that, which we are doing, is we are going to start exploring avenues to do predictive analytics, to see, can I predict trends, can I predict patterns, can I give you an analysis that if you come to Bangalore in November of 2023, should you be carrying your bottle of water, or should you be carrying a mosquito repellent? Because that is the infection that you're going to face. So that is going to be our second step, and the last step eventually is obviously to add more data sources. Now, one of the most interesting data sources available in India, which is not explored much, is weather data. Most of these infectious diseases are very weather-based. For example, I already said dengue only happens with fresh water. Malaria happens with stagnant water. So monsoons are a big role to play in the spread of these infectious diseases. The other big challenge we are facing in India, if you move away from infectious diseases like TB or dengue and malaria, is non-communicable diseases. Today, we do see a big spike in cases of hypertension and diabetes, which are not diseases by themselves, but are conditions which lead to the propagation of other disease conditions. While we combat infectious diseases in this part, I think in the future also we'll have to look at non-communicable diseases. The last aspect is mental health. I think the COVID pandemic has exposed us to the gaps we have in our mental health framework. And today we have programs nationally as well as regionally run by state which look at things like suicide prevention and depression hotlines. But I think, like the Honorable former Minister Suresh Prabhu visited our booth, he said that these are conversations which give you the symptoms. And while it will take a while for the symptoms to be registered in a hospital. So it gives us an opportunity to intervene in this case right before the person actually becomes a patient. So we are looking at health consumers, provide them support so that they do not have to even enter the hospital in a certain condition. So there is huge scope for this. The impact both on society as well as the healthcare community can be immense. And what we need is collaboration, building the ecosystem together like we've done in this case.